Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Coping with colic. Introduction. If your baby cries for more than 3 hours a day, at least 3 days a week for more than 3 weeks, he or she may have colic. A baby with colic is otherwise healthy. Caring for a baby with colic can be difficult. It can be frustrating and stressful. It is important to remember to take care of yourself. This program explains how to cope with caring for a baby with colic. It covers what colic is, how to soothe your baby, and how to care for yourself. What is colic? All babies cry, but sometimes a baby will cry for hours at a time. It may seem like nothing can help soothe your baby. This type of crying may be colic. Colic is a common problem in infants and newborns. It often happens between 3 weeks and 3 months of age. With colic, there is no obvious cause for the baby's crying. Fortunately, colic usually goes away on its own or gets better by 3 months of age. If your baby is crying for no obvious reason, you should check with your child's healthcare provider to make sure that these crying spells are caused by colic and not an underlying health problem. It is normal to feel scared or upset by your baby's frequent crying, but remember, colic is a common but temporary problem. In the meantime, try to find ways to soothe your baby. Remember to also take care of yourself. Soothing your baby. A baby with colic may cry for no obvious reason, but there are ways you can try to soothe your baby. Try singing to your baby or turning on some soft music. This can also help keep you calm. Other noises may help soothe your baby as well. Some babies cry less when they hear a steady noise. You can turn on a kitchen or bathroom exhaust fan. Make shushing noises to your baby. You can also play nature sounds such as ocean waves or rain. Try to give your baby a pacifier. Sucking a pacifier helps comfort many babies. Sometimes babies may quiet down when they are held or swaddled in a light blanket. You can also use a sling or other baby carrier to keep your baby close to you while you do other tasks. Some babies need motion to calm down. Try gently rocking your baby back and forth. You may also use a vibrating bouncer or baby swing. In some cases, taking your baby on a car ride can help calm them and maybe even put them to sleep. A warm bath may help soothe your baby. You can try gently massaging your baby as well. If nothing seems to work, try putting your baby in his or her crib for 5 to 10 minutes. Sometimes this can help calm a baby. Some of these methods will work better for some babies than for others. It is important to try different techniques to find what works best to soothe your baby. The techniques that work may also change from day to day. One day your baby may want to be held, but the next it may work better to let them lay in their crib for a few minutes. Talk to a healthcare provider to learn other techniques for soothing. Sometimes changing your own diet if you are breastfeeding can make a difference.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Taking care of yourself. Trying to understand your baby's crying can be frustrating, especially if your baby has colic. Remember to relax. Staying relaxed makes it easier to soothe your baby. Do not take your baby's crying personally. It does not mean you are a bad parent if your baby is crying for no obvious reason. Make sure you get plenty of rest. Not resting enough can cause you to become frustrated faster. If you start to become frustrated, get help from your spouse, partner, another family member, or a friend. A short break from the crying may help you calm down. Making other healthy lifestyle choices can also help. Eat healthy and avoid alcohol and other drugs. Make time for exercise. If you are stressed or frustrated, talk about your feelings with a loved one. It is normal to feel this way. It is important to remember to be gentle with your baby no matter how frustrated you become. Never shake your baby. This can lead to blindness, brain damage, or even death. Remind yourself that this crying stage is temporary. Colic often improves or goes away by 3 months of age.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. All babies cry, but sometimes a baby will cry for hours at a time. It may seem like nothing can help soothe your baby. This type of crying may be colic. Colic is a common problem in infants and newborns. It often happens between 3 weeks and 3 months of age. If your baby cries for more than 3 hours a day, at least 3 days a week for more than 3 weeks, he or she may have colic. A baby with colic is otherwise healthy. A baby with colic may cry for no obvious reason, but there are ways you can try to soothe your baby. Trying to understand your baby's crying can be frustrating, especially if your baby has colic. Remember to relax. Staying relaxed makes it easier to soothe your baby.
Thank you for using Explain.